You've done it. You've survived nursing school. All the clinicals, the late-night study sessions, everything. And now there's just one last thing standing between you and that RN license, the NCLEX. So today, we're going to break down the exact blueprint you need to not just pass the 2026 exam, but to walk in there and absolutely conquer it.
Right. That's the million-dollar question, isn't it? Is there some secret trick, a magic formula? Well, I'll tell you right now, there isn't. But what there is a strategy, a really clear, doable plan that's all about understanding how this test thinks. And that is exactly what we're going to map out for you.
Okay, so let's jump right in by decoding the test itself. Honestly, once you get the how and why behind the NCLEX, you take away all the mystery and the surprises. And trust me, that's half the battle won before you even start studying.
First thing you have to wrap your head around is computer adaptive testing, or CAT. This is not your typical test. It's smart. It's actually reacting to you in real time. You get a question right, the next one gets a little bit tougher. You get one wrong, it eases up a bit. The whole point isn't to get a perfect score. It's to prove you can consistently answer questions above the passing line. That's how it knows you're a competent, safe nurse.
So here are the key numbers you've got to know. You get up to 5 hours for a max of 135 questions, and it's strictly pass-fail, based on something called a logit score. Just think of that as the computer's confidence level in your abilities. Once it's 95% sure you're above that passing standard, the test can shut off. And of course, the big one. It now includes the next generation, or NGN, question. And this, right here, is the biggest change you need to get ready for. The Next-Gen NCLEX, or NGN, is a total game changer. It was built from the ground up to test your clinical judgment. It's not about memorizing facts anymore. It's about, can you take what you know and apply it in a messy, realistic patient situation? It's about how you think.
Okay, so we know how the test works. Now, what's actually on it? The good news is the NCLEX gives you a roadmap. It's broken down into 4 main client needs categories, which basically tells you exactly where you should be spending your study time.
Now, take a look at this. The percentages here tell a really important story. See those 2 huge chunks? Management of care and physiological integrity. I mean, physiological integrity can be over half the exam. Together, they are the lion's share of the test. This is your cheat sheet for studying. All areas matter, for sure, but your grasp of fundamental patient care and leadership is absolutely crucial.
Now here's something that can trip people up. You might be looking for a section on communication or the nursing process, but you won't find one. That's because these are integrated processes. Think of them like salt in a recipe. They're not a separate ingredient you add at the end. They're mixed into everything. So even when you're answering a hard pharmacology question, you're also being tested on how you teach the patient about that medication. It's all connected.
So keeping that structure in mind, let's zoom in on the biggest piece of this puzzle, getting good at the NGN format. This is, without a doubt, your key to passing. This slide just nails it. The old NCLEX was basically asking, what did you memorize from your textbook? The new NGN is asking, okay, you've got the facts, but how do you use them to make a safe call at the bedside? It's a fundamental shift from just knowing stuff to knowing what to do with what you know. So, how do you show clinical judgment? You follow these 6 steps. This is the exact mental model behind every single NGN question. It's about spotting the important data, figuring out what it means, guessing what's going on, coming up with a plan, doing it, and then checking to see if it worked. You need to make this process second nature.
And to test this new way of thinking, they had to create new types of questions. You're going to see case studies that give you a whole patient chart and then unfold over 6 questions. You'll see these bow tie questions where you literally have to connect the dots between a condition, the right actions, and what you need to monitor. The key is to practice these so they feel familiar, not scary on test day. All right, you've got the structure, you know the content, you know the question types, you have the what and the why. So now let's build the how. Let's talk about your actual, concrete, high-impact study plan. First things first, this takes commitment. Let's be real, this is not a test you can cram for the weekend before. Most people who pass successfully report studying somewhere between 75 and 150 hours. So find that time in your calendar and block it off. It's an investment. And what's the single best thing you can do with that time? Practice questions, period. Volume and consistency are everything. Aiming for over 100 questions every day does 2 things.
It builds up your mental endurance, and it exposes you to so many different situations that you start seeing the patterns.
But listen, it's not just about doing tons of questions. It's about studying smart. Find out where you're weakest with a diagnostic test first. Then, instead of just rereading notes, use active recall, like flashcards or teaching the concepts to someone else. And this is the most important part. You have to read the rationale for every single answer, even the ones you got right. Understanding why an answer is correct is where the real learning happens.
Okay, let's tie all of this together. All this prep, all these hours, all these questions, it's all pointing to one thing, right? Getting across that finish line. I really want this quote to stick with you. The NCLEX isn't trying to trick you or test you on some obscure fact you learned once. It's there to confirm that you are a safe, competent, entry-level nurse. You have put in the work, you have the knowledge, and now you have the blueprint. You are ready. So walk into that testing center with your head held high and go earn those 2 letters after your name, RN.